Hello, hello, hello. Assalamu alaikum. 𝐷𝐸𝐻 𝐂𝐸𝐻𝐿 Ni hao, Chunashumme, Washmale, 𝐷𝐸𝐻𝐽𝐬𝐧, Guten Morgen. Hi, hugs and hellos to everybody who's tuned into PTV World and are watching World this morning alongside Maha Makhdoom and Shahzad Khan. Hello, Maha. How are you? Good morning. Assalamu alaikum.
Assalamu alaikum, Shahzad. Hello, everyone. Our show is linked with that. We're doing a show on drug addiction today. And, it is a strong subject for just after Eid, but these are, we wanted to continue our positive and healthy living even after Ramadan. And it's about continuing the whole year like that. So we're going to talk about the different types of addiction. What's the situation in Pakistan? So we have been joined by some wonderful guests in the studio. And we're going to also give you solutions to make sure that we can help the people that are in need.
Exactly.
So we've been very lucky. We've been joined by Dr. Sadaqat Ali. He is an addiction specialist at 𝐕𝐢𝐬𝐧𝐬, Pakistan. Assalamu alaikum. Good morning. Thank you so much for joining us
And I
today.
love your suit.
It's very smart. Thank you so much. Besides Dr. Sadaqat Ali, we've been joined by Dr. 𝐷𝐸𝐻 Masroor. She is a consultant clinical psychologist and she's a professor at Bahria University. Assalamu alaikum. Good morning. Thank you so much for joining us. Always a pleasure to have you on the show.
I think Bahria University will be very happy to have you as a professor over there.
Yeah.
Because every time you come over here, their names get mentioned.
Yeah, and also because you're wonderful. So besides Dr. 𝐷𝐸𝐻, we've been joined by Dr. Faisal Rashid Khan. He is a consultant psychiatrist. He's also a assistant professor at Al-Nafis Medical College and Hospital. Assalamu alaikum.
Amazing that is. Thank you very much for joining us. And I'll get started with the conversation from you, Mr. Faisal, Dr. Faisal, in fact.
No, from Dr. 𝐷𝐸𝐻.
Okay, so let's start from Dr. 𝐷𝐸𝐻,
Yes.
whatever Maha says. All
Yes.
Right? So, Dr. 𝐷𝐻, first of all, let's just define what addiction is.
Yes.
Addiction basically is a behavior that is regarding some drug or some substance when somebody is is quite used to taking it to that frequency, to that extent that it becomes difficult for him to leave that. And it definitely interferes with the functioning of the person as well. He is no more able to continue with his regular activities of the day, and the body is also very dependent upon that drug. And then there is no limit is marked for that person, and it is beyond his own control. That it is very difficult for him to understand whether at what level he should, stop taking it. So drug dependence is something like drug taking is a normal behavior sometimes, not exactly about. I'm not talking about specific drugs, but when we extend this towards, we will be discussing that later on as well. But any substance that is not what I would say is not healthy, and the person he starts taking it, then it becomes its habit. He's habitual to it and he's dependent on it. And when this taking behavior, extends to that level that it is difficult for him to get rid of it, then it is, enters into that. And afterwards, what happens to the body, that body is used to of that drug, that particular substance, so it becomes, intoxicated.
Okay, so Dr. Sadaqat, I'd like to ask you, because you're at 𝐕𝐢𝐬𝐧𝐬, for you guys at 𝐕𝐢𝐬𝐧𝐬, how do you define addiction?
Addiction is basically an excessive behavior as well as use of some substance sometimes which is out of control, and there are negative consequences which the person cannot look at, because all of us live on the other side of our eyeballs and we cannot look at our own behavior. So usually when people are in addiction, they are also in denial.
Okay.
They would never accept that their use is excessive, or they would never accept that there are consequences which are negative. There are so many wake-up calls in their life, but they would not listen to those calls.
All right.
So ultimately, an addictive continues to use like this. This is a primary, chronic, progressive, and if untreated, it is a fatal disease.
Okay.
Yeah.
So now moving on to Dr. Faisal. Now, Dr. Faisal, what happens is that, people do have their own limitations, right? Somebody might think that, doing this much amount of substance will not actually make me an addict. So what is, how do we confine to limit that, okay, this is drug abuse and this is not drug abuse, using the same drug?
I think it's very difficult to determine for an individual, because there can be genetic predisposition. So if 3 or 4 brothers, they are taking the same substance, 1 or 2 might get hooked onto it, and rest of the 2 they don't. So this could be one explanation. But I think going back to the previous question, I think we need to be clear in talking in terms of medical science.
Yeah.
I think dependence is when the person loses control over his or her drug-taking behavior. When you don't take the substance, you have craving. When you don't take the substance, you have withdrawals, where you get irritable, you can have insomnia, you can get anxious, and you develop tolerance. So if I'm having the same effect with single cigarette or with single tablet, but with the passage of time, I have to increase the dose to get the same amount of effect. That's very important. And of course, as other things mentioned by the two participants.
Okay,
but what
excellent.
about the use and abuse as well? Let's talk about that. I mean, because what happens is that people do not really know at what point of time they're abusing it, or they're just using it. This is where I wanted my audience to be clear.
On a reality.
Yeah, because what happens is that we have seen, since we have been doing shows on such amazing topics as well, so what we have seen is that in our society there's a higher trend of women getting addicted to drugs, and those drugs are obviously being prescribed by the doctors as well, but they are abusing the use of it. So now how do we...
The use of a drug is within prescription limits. So you're advised a drug, you take it, and then you stop it. Abuse happens when you take it out of the recommended dosage, out of recommended prescription. Dependence, as I already mentioned. When talking of women, I think we will be talking about different drugs of abuse.
Absolutely.
But I think it's important to mention sleeping pills, because that's one area which is very easily sidelined. But they are the drugs which are prescribed by the doctors, they are easily available from the pharmacies, and they are very commonly abused.
Okay.
Would you mind naming a few of them as well, so that for all those parents who are out there who might not even know what their kids are carrying within their cupboards, so if they go around and they check, so at least they will know that what their kids are using, I think.
So since you have asked for it, I think drugs like Xanax, Alp, Lexotanil, Rivotril, these are benzodiazepines. These are drugs of addiction. They quickly lead to dependence, and they are treatment for nothing.
Okay, absolutely. Okay, so great. So that's one segment of society that is abusing one particular drug because it's easier accessible in this country. But we'll talk about the different people who are abusing.
I would like to add something to what Dr. Faisal said.
Sure.
Yes.
Addiction is psychological as well as physical.
Yeah.
Psychological addiction is that if you don't take it, you have cravings. The physical addiction is actually a physical disease like diabetes. Like people have diabetes and they cannot metabolize carbohydrates appropriately. Likewise, if people are into addiction or alcoholism, they cannot metabolize drugs normally. There are abnormal byproducts that are produced, and these products are toxic to the body. That is how we define intoxication in alcoholism.
Okay.
There is some toxin circulating in the blood which definitely hampers the abilities of that person. He becomes repetitive, he is not able to speak properly, he cannot even walk sometime.
Okay.
So it is because of that toxic substance that is circulating in the blood.
Okay, so that's the thing. So we've jumped ahead to what kind of drugs are being used, and we've talked about specific. Let's talk about the different segments of society now. So we've briefly mentioned the different types, the choice of drugs that are in use, but we'll come to that a bit later on. The types of addiction that we have now, like you said, there's a genetic predisposition, then there's environmental. So there's peer pressure when you're in your teens. Now, psychologically, Dr. 𝐂𝐨𝐫, what are the causes that could lead an individual, starting from a young age, towards addiction or drug abuse?
So
drug addiction.
Yeah, before answering this question, I would like to add whatever we have been discussing previously. There is a fine line between dependence and then, abuse.
Right. Okay.
So, we were talking about how would we know that we are addicted to that. Beyond that prescribed amount, definitely the function will also deteriorate. So the whole body's reactions to that drug, and then your own psychological and behavioral reactions, which are different from your prior functioning. So it is quite indicative of this thing that you have.
So let's talk about that. So because as we've said that,
so psychological factors, this behavior is more common in adolescents. Of course, other would also support this, that at any age this behavior starts, but I would say adolescent age is more prone to more vulnerable stage of an adolescent, when he is unable to differentiate between right and wrong.
Okay.
So once he gets into the company where the people who are already taking it, so he can easily indulge into this, and and later on this it becomes social issue, then it family issue, then social issue. So slowly and gradually, it is very difficult for him to get out of it.
Okay, now, okay, so that's fine, but so one aspect, one factor that could push an adolescence is the company that you keep.
Yeah.
So if other kids are doing it, so Dr. Sadaqat, who you're at this center, what are the other reasons that adolescents are turning to drugs?
Actually, normally people think that there are genetic tendencies because of which people use drugs, but there are no such genetic tendencies because of which people use drugs. There are genetic tendencies because of which people become addicted to drugs.
Yes, okay.
It is
the addiction aspect,
the
that's
physiology that is converted into pathology. So as they cannot metabolize drugs normally, and there are abnormal byproducts, so they become addicted to the drugs because they get benefit out of drugs. At the same time, they have adverse side effects, so their life becomes unmanageable. They become
And with that, I think I would love to move on to Dr.
but the
Faisal
same,
over here.
yeah, but my question, I still want to know, what are the other factors that an adolescent, so Dr.
Another important biological factors, there is a center in the brain which is called reward center. So there's a chemical called...
Can you please speak a bit louder, because you're sitting a bit far away. Yeah, it's getting difficult to hear.
So there's a center in the brain which is called the reward center.
Okay.
So it releases a chemical called dopamine. So whenever we are really happy, we are joyous, it gets released. What happens with drug users, whenever I take a drug, dopamine gets released. And it's such a reinforcer, it's such pleasurable that I want to take the drug again.
Right.
And that's why people take it once, they want to take it again and again.
Okay.
What about those happy things which our brain excretes?
That's dopamine.
Dopamine.
So we just said, yeah, dopamine.
Okay, so this is what stimulates our brain.
So when Pakistan beat Sri Lanka, dopamine got released
And
all
everyone was
over
very happy.
Pakistan.
Yeah, but okay, then
So
what
it is-
happens when excessive dopamine gets released just because of the fact that the guys or the girls are abusing it?
So the person can go into psychosis, where the person can hallucinate, that is hearing voices. The person can have delusions, these are false beliefs. The person can be violent, aggressive.
Anxiety.
Yes, anxiety can
Yes,
shoot up.
because the senses are over,
Okay. No, the thing is,
stimulated.
I mean, getting too happy is not even good.
okay, but
No,
no,
not
it's
at all.
absolutely
That's
not.
what it is.
So
Everything
there are personal factors as well. I was talking about the age level,
Yeah.
and I will also talk about the personality of a person.
So this is what exactly what I
Because
wanted to know.
exactly-
No, but before you move on to, very sorry for that. The only thing which I wanted to ask Dr. Faisal was, because earlier when we were conversing, you said that there is a genetic tendency to do that, right?
No, to addiction.
But to what Dr. Sadaqat Saab said, I totally agree to that.
People use drugs because there are other people around who are using drugs.
Yeah,
The
fine.
major reason to start using drugs is that you see other people doing that.
Okay.
But there are
Availability.
people who have genetic tendencies who actually later on cannot use drugs in a proper manner because their infrastructure in the body is not compatible
Exactly.
with that.
So
Got it now.
basically, so Dr. Fess and Dr. Sadaqat are saying that there's a genetic predisposition to addiction, not to actually choosing to use a drug.
Yeah.
That is your
Yeah.
individual choice. Sorry, guys. That's your own choice.
And I
But
think
to start doing drugs, there is one reason that people start using drugs because they have not adequate human skills. Human skills are
This is what I'm trying
same
to get,
as you call executive skills.
Exactly.
So organizational skills, time management, stress
Yeah.
management, and looking at your own behavior,
Self-worth, only
finding
psychological.
creative solutions when you need them. So when people lack these basic human skills, because parents do not let them learn those skills, they are pampered children usually. So they are likely to use drugs if they don't know how to manage their life on daily basis.
All right.
Okay, and also, so Dr. Uzma,
Yeah.
the psychological, 'cause
Exactly.
this is what I wanted you to tell me
I
before.
will second Dr. Sadaqat Saab. This is all, you know, personality traits, personality factors, and definitely human being is not all alone who constitutes its own personality, but it's all society, the family, the environment, everything contributes to that. And sometimes children, they are definitely not, you know, put into a situation where they learn these skills, problem solving skills, stress management, and they are rather helped out, and they are not, you know, forced into a situation where they need to manage their own stress. So for that purpose, we consider drug abuse as an avoidance behavior, because they do not want to go back to their problems and to solve them, or they do not find anyone to support them, to help them out with them. So sometimes they do not find anything to solve their problems, and they find refuge into this behavior. So it is very easy for them just to take themselves aside and just, you know, indulge
Yeah,
into
just
the
shut down the
behavior.
window and not look at it.
Exactly.
I think that's what it is. But, you know,
Exactly.
I think since we are here to raise awareness as well, can we just talk about the numbers, for example? Let's talk about the age of the children who are actually getting addicted to all sorts of drugs as well. And from which age to which age does it really vary as well?
So we'll start with
The,
Dr.
the number is alarmingly growing. Right now, there are about 7.6 million hardcore drug addicts in Pakistan.
In
There are-
Pakistan?
yes, there are many other who use drugs, but they are not still addicted to that. But it is very likely that in near future, youngsters will be using drugs.
In any case.
And it will be quite normal to use drugs in near future, and it will be an exception if some youngster doesn't use drug.
It's becoming a
Until
norm.
and unless
Oh, how? You don't do
until
it.
and unless we take precautions and immunize our youngsters, so they are quite capable of living a full life without using drugs.
Well, what is the age category in drug addicts right now? For example, 13 years of age, 15
No,
years, or
right
17
now
years?
people are using drugs in their teenage.
Teenage?
Previously, it was
Now it's preteens.
not in teenage. Even preteens are using drugs. So the age is also falling down over the youngsters. So they are using drugs early on now. And as you use drugs early on, there are more chances of becoming addicted to drugs.
Yes.
Like previously, people used to use drugs after 40
Yeah.
year of age,
Right.
but now it is very common.
Even 11-year-olds, we did
Yeah.
a show on this just recently, and especially in private schools, the abuse of prescription drugs has increased. That's what we're reading. Okay, so now let me ask Dr. Faisal. You said that, you know, in the different types of addiction with different ages, it's different symptoms and signs and behaviors that we can. What are for preteens or teenagers, adolescents, what are the signs and symptoms that parents should be paying attention to? That maybe my child might be prone towards addiction, or they might be prone towards taking drugs?
I think most important is the change in behavior. So if your child is either sleeping more or sleeping less, staying out for long periods, has gone into seclusion, or the child is exhibiting anger outbursts, tantrums, irritability, then, or if the child is hiding something. So I think these are the warning signs.
Okay.
So where the parents should get alert.
Okay.
Yeah,
Okay,
and,
but
and
then they
these are
very
out of
famously-
nowhere, like without any prior history, without any prior you know, indication, some child starts showing this behavior that is quite abnormal, and it is very easily, you know, observed.
Okay.
So
And I think
very
the parents
correctly
just know it
mentioned.
anyways that, you know, their kid is up to something or not. But
Or
other
because
than
of
that,
denial.
there's a very famous saying where they say that smoking is a gateway to all the drugs out there as well. Do you think that that's correct?
Yeah.
That's also correct, but falling grades is a clear
Exactly.
indication. If
Yeah.
you look at the grades that start falling suddenly
Exactly.
with a previous history of good grades, if somebody has falling grades,
Yeah.
then you should look into the matter.
Exactly.
Okay.
And-
So you all agreed with that statement. Now the thing is, we know there's millions and millions of smokers out there, millions, but not all of them are drug addicts or into drugs or even have touched drugs. So Dr. Faisal, so is that where that genetic predisposition comes in? Is it a gateway?
Cigarettes, smoking
Sorry,
is
let me
itself a drug.
let me ask Dr. Faisal, and then we'll come to I'll come to you. Sorry.
You see, it's not that simple. I think we need to have a holistic view of things.
Right.
I talked, one aspect is biological, then we can also have psychological and social aspects too.
Yes.
So if, psychologically speaking, if I have poor stress coping, I have not developed social skills to deal with stress, then drugs can be one way, unhealthy way of dealing with that stress.
Exactly.
And it's kind of an escape from my responsibilities, from pressures. Then social factors. If the drug is easily available, it's cheap, it's the friends are using, so then you see I'm predisposed or I'm at risk of going towards drug taking behavior. And once I start using it, maybe I start with cigarettes.
Okay.
So then if my stress goes on increasing and I don't develop adequate skills, then I might be introduced to cannabis, then to heroin, and it goes on.
Yeah.
Dr. Sadaqat, you want to add?
That's how we underestimate tobacco smoking a lot.
Yeah.
It is a real drug. It is a very strong drug, and it is equally difficult to quit smoking compared with heroin addiction. So when we start taking smoking cigarettes for granted that this is something which is
Socially
acceptable.
acceptable, yeah.
So any time after smoking cigarettes, you can be introduced to another drug and you will welcome it. And other drug which is very common and is not considered a drug is alcohol.
Yeah.
Even in Pakistan, there are about 1 million alcoholics, which means there are about 10 million people who consume alcohol on regular basis. So that is also a gateway drug. Once you start consuming alcohol, there will be another day, then you would start consuming cocaine, which is now in epidemic proportions in Lahore, Karachi, Islamabad, and Faisalabad, and in other big cities of Pakistan. So that is also a real threat. Previously, cocaine was not available in Pakistan, but now cocaine is in fashion. So there are all-night parties where people consume alcohol first, then they start using cocaine to get rid of that intoxication that follows.
To get rid of an intoxication, they're getting intoxicated with another
Okay.
drug. Wow.
Yeah, this is
So
all
they're
about the
confusing themselves.
replacement,
Sorry, Dr.
the reward
Yes.
system Dr. Faisal was talking about. Like if you want to take one thing out, then you have to add something else, more
That's where I was
rewarding into
coming.
the system.
Now, with all of these addicts or with all of those people who consume all of these substances, they have this psychology where they want an alternative to
Yeah, exactly.
stop or
Very
refrain
right,
themselves
very
from
right.
doing which they were doing earlier as well. Now, how do we get rid of that first of all, and we need to move on towards solutions because
Yeah.
we do not really have much of time.
Then I want to ask Dr. Asma first this question, like Shahzad said, that now the thing is, we laugh when we say, okay, to get rid of one, we're doing another.
Yeah.
But that's not funny because this
Exactly.
person is struggling to get better. And
Exactly.
you need to replace
Exactly.
a habit, right? So what do we do?
You know, behaviorally, I will definitely, my guests, they will be talking about the, physical replacement of the drug, definitely. But I'll be talking about the behavioral. Since we were talking about the reward center of the brain, so reward could be of any form, like watching a match as well. So distracting a person, from regular activities into more interactive, more, I think, interesting activities which are more appealing to the person could be one of the solutions. You can take the person away from the, typical environment, and you can spend some days somewhere else, or you can enlist certain activities which he would like to indulge into. So I think distracting him would be very helpful in such case.
Okay.
Now in Brazil, I'm sorry, but I think I need to share this very interesting example. So in Brazil, they knew that cocaine is an epidemic now, and everybody's using it, and it's dangerous for health and whatnot. So what they've done is that they serve you with something which is an alternative, but it's a very amazing alternative, that they serve you with some chocolate powder. So what you can do is that you can sniff it, and it's going to give you that dopamine hit or
Exactly.
whatnot. So they found an alternative to that,
Yeah.
and people are getting hooked to that again. So then even consuming chocolate powder so much cannot be healthy, right?
Anything in excess is not good for you. But
Yeah.
well, let's start with Dr. Faisal. What do you think of replacement of?
Well, it depends.
So this is in the solutions and the treatment
Yeah,
area.
it depends which drug you're talking about, because when you talk of heroin, opioids, yes, there are replacement therapies available, not in Pakistan, but yes, world over. But I think when we talk of treatment, I think most important thing is the assessment, where you assess the person for motivation. I think that's the most important thing. Because most of the times when people are brought to these health facilities, they are not motivated to quit. They are detoxified, they go back to the community and they restart the drug.
Exactly, because
So the first thing is to assess for motivation in a non-judgmental manner, as we discussed before. Then comes the detox part, where you remove the substance from the body, and then the rehab part, where you avoid those triggers which took you towards the drug.
Okay, how about you, Dr. Sadaqat? What do you guys do?
Is that how the cycle goes?
Indoor treatment is now on the exit in most parts of the world. Now, indoor treatment is going to be obsolete in next 10 to 15 years, and most people will be treated as outdoor clients.
All right.
And there are three ways people can quit any drug, and one is through sheer willpower, and 4% people have that much willpower. Unfortunately, not all people have that much willpower, but 4% people can quit drugs when they decide to, when they are motivated enough. There are about 16% people who can use their agency. Agency is value-added willpower. Along with willpower, they have family support, they have support from the social capital, their friends. They can change their geographical positions. They can get help from people who have already quit drugs, and they need inspiration. They need a lot of knowledge. They need skills. They need trainings like mood management training. But there is another bigger chunk, which is 80% of the drug users or abusers. They need total transformation. They need the reconstruction of their life. So they need a Minnesota model, which is 12 steps program, and then there is a fellowship. They are incorporated in that fellowship, and that is also an outdoor program, and they need to reconstruct their life one more time.
Okay, so it's an ongoing thing, because I think once
it's an ongoing thing. Like people think that we will go to a rehab and the problem will be solved. It does not happen like that.
Okay. So once you become an addict, my dad once said that once you're an addict, you're always an addict, but you're a recovering addict. Is that true, Dr. Faisal? Do you think?
Well, with all the positives, relapse rate in drug abuse is very high. So you're going back to the same environment, the drug is easily available, you're sitting with the same friends, you're in the same job, it's cheaply available. So all these factors, and the stress is also there. So your chances of getting a relapse are high.
Anyways, so Dr. 𝐂𝐨𝐫, if someone is not going to a facility and they come to you, so a parent has brought in their child, or a wife has brought in their husband. You know, we said that women are abusing prescription drugs, but men are also into extremely hard, like heroin and all these things as well. You know, you see them on the streets walking around in Lahore and all these places. Now, that type of person comes to you. What would you say to them?
I think counseling and reorientation of a person towards his own life. I think, again, reassessment, you know, the assessment of maybe his needs, maybe his priorities, maybe his failures in life, maybe some other reasons which led to this behavior. So we can always have these counseling sessions. We can discuss with them what are their strengths, what are their weaknesses, what they need to cope up with, what are the healthy and unhealthy ways he is adopting for, you know, for the solution of those problems. So we can always discuss that. And most of the time, I would say people respond to that. Lately, I'm very happy about this. During my practice, I've observed that families are very vigilant. They are very cooperative in this sense. They want their, they want their persons to, although I'm not talking about 100% population, I'm talking about most of the families now I am dealing with. So they are cooperative, and education level, usually the families we are talking about is where the education level is low. So we can always educate them on this forum, and we can let them know that this is a condition that a person can always fall in. It is just like a normal disease. Of course, this is not a good behavior, but again, not knowingly, not you know, intentionally, a person falls into this.
Dr. Faisal, you want to say
I think just to add to that, even if the person does not want to leave the drug, it's still important to reduce harm. So if the person is using IV drugs, that is injecting intravenously, so not sharing needles, using a sterile needle every time.
And it's happening in different parts of the world as well.
Yes,
so healthy
exactly.
practices.
But
So
other
we
than
have
that,
to move-
well, other than that, there's one more thing which I need to ask Aware. Since we need to talk about solutions, and since we are moving towards solutions, the thing which I wanted to ask was that we do have both extremes, right? On the both ends, there are people, there are families who can be very supportive, then there are people
not
who
supportive.
not. So then, you know, there are a type of people who go or move up to their parents and say, confess, okay. The next day, they're forcefully sent to a rehab center, and that's where they feel very disoriented,
Again.
they're distorted, they're shambled.
Exactly.
So how do you think that the families need to probably move on with
I
that?
think this is the most frequently seen phenomena right now for me, because I have seen children, adolescents, adults, they want to quit with this all, but at the same time they do not want to be sent to some facility. So I think it should also be considered what is, you know, their understanding. If they are want to move towards their life, that they should be encouraged. I think on the part of the family, it could be educated, it could be counseled. And I think they should be, you know, provided education upon that.
Alright.
And sometimes, again, I would say, I'm very hopeful about that. Most of the families, if they are, you know, communicated properly, they respond to that.
Okay, that's wonderful, and that's, you know, a really good question that you asked. And you know, you've all dealt with these. You've all dealt with these families. And the question I'm going to pose to you,
Yes,
so you
please.
would-
It
Before I
takes a
ask you-
family. Actually, it takes a family, and if family comes into counseling, they would learn a lot of
Exactly.
things, and they would inspire their loved one to get counseling too. But what we do is that we counsel the families, and ultimately families become counselor themselves, and they counsel their loved one, and that is how we start the process of change.
So we're going to talk, and the thing is also one thing that we really forgot to highlight was the actual consequences, because parents and families and even the drug user go into the denial of, I'll be fine, it won't be me,
Saada bacha kar hi nahi sakda ji.
or as in they'll recover.
Exactly.
Now, I'm going to start with Dr. Faisal, and I'll work my way down. What are the ultimate consequences? You know, the parents that you see that go into denial, what's the bad stuff that's happening to their kids?
I think I would stick to the medical complications.
Yes, please go for that, and we'll use the social ones from the other two panelists.
So take for instance cannabis, which is commonly called chars, and it's considered that it's a safe drug as long as you're taking it in required amounts. It doesn't harm. But the thing is, it can. In the immediate terms, it can cause psychosis that we discussed earlier.
Yes.
In the long term, with the long-term use, it can cause a motivational syndrome where the person loses drive, initiative, your memory gets weak, your ability to concentrate goes away. And when we talk of sleeping pills, as we mentioned before, again, it increases your anxiety levels, it worsens your depression, it decreases your memory. And the opioids, the heroin, it can cause hordes of complications, medical complications like infections, hepatitis, tuberculosis, HIV/AIDS. Then you can develop skin infections, you can develop heart diseases, lung diseases. So there's no limit to it.
Okay, and actually just for all our viewers, for all our older viewers, because it is for older people, there's a film called Requiem for a Dream, and that shows the exact dangers in a you know, we talk about glamorizing, but this shows you the dangers of drug abuse. Okay, now, so that was the biological consequences. Dr. Isma, what are the psychological, as Dr. Faisal already mentioned psychosis, what are the other damages?
Yeah, with the persistent use of the drugs and then inability to cope with that, it might lead to more low self-esteem, psychological issues like depressions, anxiety, depressive states and anxiety, and some other issues like low self-esteem. I've already mentioned it. But along with that, there is also a very observable decline in relationships as well. And the person, he gets this image that he is a loser in life and he is not able to cope up with anymore. And then definitely there's a cycle that goes on. You know, it produces anxiety, depression, and the other states also. So again, sometimes there are certain milestones in life that are to be achieved at certain level, and if they are not, they cause, I think, irreparable damage to them, and it adds to the, self-esteem.
So what are the, you know, in the sentence, what is the worst case scenario that you see?
In my opinion, harm doesn't come from drugs per se. Harm comes from the reaction of our body when the body is unable to consume drugs normally. There is some metabolic error, and body cannot metabolize drugs in the appropriate way, and there are toxins that are produced in the process. Those toxins cause the damage, because of toxins, a person cannot think clearly, he cannot make good decisions, he cannot fulfill his responsibilities, and he's focused on getting more and more drug, because whenever he uses drugs, he feels a little better, but then toxins are produced and he feels worse. And to feel better, he needs to consume more drug. So then there is a reaction from the family and the society that also causes a lot of damage, because family behaves in two manners. Family provokes the addict, and then family enables him because they feel guilty after provoking him. So they agree to what they disagree to begin with. So they become angry, they become depressed, they become shocked. They are also consumed. They become addicted to the family member who is addicted to the drugs. That is what we call as codependence. So that codependence is also an addiction, that the family members also have unmanageability in their life. They are just focused on their drug addict, they don't know what to do, and then they are panicked and they start doing things which are
I'm so glad you mentioned this, because this was one thing that we kind of, I think, maybe skimmed over during the conversation, is that yes, families are very supportive, as everyone has said, by the end of it, because they want their child to get better. But the thing is, there is this where you first provoke the addict and then you enable them. Now this, I think, is quite prevalent within our society, because our parents love us so much, and they're always parenting us until our 50s and 60s, if they're blessed with a long life. So they don't want to feel bad, and an addict is very good at manipulating the people around them and also destroying their lives. It's not just one person's life that's destroyed. Now, how do we, what are the solutions to this? Because as Shahzad said, we've been discussing the solutions. How do we resolve this aspect of it, where you have an enabling environment, but you also want to treat the person? What's the solution?
Because I think the authorities need to play their role as well. I think
Dr. Faisal?
It is very essential and important and pivotal as well that we tell the authorities to play their role, because if everything's going to be easily accessible, I think it's just going to be going to a Sunday market, buying some fruits, coming back home, and it's as easy as that.
I think very important, the family needs to be on board for the person to stop taking the drug, and also for their rehabilitation. Some families, if they are expressing high expressed emotions, if they are hostile towards the person, if they are critical of the person, then that behavior needs to be addressed. The family itself is under a lot of stress, so they need to seek counseling, they need to sit in support groups so that they also learn to deal with their stress, so that they are better able to cope with, help their relative.
Okay, wonderful. Okay, and because we talked a lot about the psychological and the support from the families, but Dr. Faisal, sorry, another question, just medically, what are the solutions medically? Is there any medical treatment for drug addiction out there?
Again, it depends which drug you're talking about. But yes, there are two ways of stopping. The person can stop the drug instantly, or then the person can stop the drug gradually.
But isn't there the physical danger of going to instant, especially if you've been in addiction for so long? Can't that also cause...
For that you need to...
go on.
Sorry, there's so many important questions. We don't want people to put their kids in danger.
Yeah, for that you need to be in inpatient facility for that to happen. But yes, if you're talking of sleeping pills, there's a way to stopping them. So you go towards long-acting drugs, you stop them gradually over a period of 2 weeks, 1 month, 3 months, depending.
That's and you have to be determined as well. Well, one last thing very quickly from Dr. Sadaqat, that is that, since you mentioned about this newer treatment, which is outdoors as well. So the treatment we knew earlier was rehabilitation centers where people were forced and, thrown inside and were treated like animals, literally. Do you think that this treatment is better?
You know, for the last 300 years, people have been treated for drug addiction in rehabilitation centers, and now we call it an upside down treatment.
Okay.
As the patient goes to the rehab, he stays there for about 3 months, and family thinks that everything is now over and their troubles are over and they will be living happily thereafter. But as soon as the person comes home, the trouble starts again, and then they are disappointed, then they quit their efforts to help him also. And after 6 months, when he is again in a very bad shape, they will take him to another rehab. So going to a rehab is now going to be an out of fashion thing. So the newer treatment which is emerging all over the world is the upside up program, in which the patient starts counseling and he is still using, but he works on his manageability in life. So the manageability is one factor. If you work on the manageability, drug use is going to reduce.
Okay.
And he has to take interest in many other things, because addiction means that you are added to a drug. Addiction,
Yes.
the word addiction means that
Totally
you are
got
added
you.
Which
to
we did
something.
at the beginning. Okay, so Dr. Faisal, we're
Yeah,
very short
quickly.
of time.
I think, yes, very briefly, I think it's very important to treat the underlying mental illness also, because it's usually depression, anxiety. That's why people resort
Absolutely.
to drugs. So
The
once
cause
they
of
are-
it.
Yeah.
So
So once they
this
are
is
in
what we
rehab,
discussed briefly. as
Usually
well.
there is a dual disorder that Dr.
As-
Faisal is referring to, and it is very important to treat the underlying cause also.
So let's join hands to, get rid of this menace. I think that's what we need to do, and let's be supportive of the fact where people are coming up front and they're confessing to what they have been doing. So please make sure that you do not really use any harsh words.
Have a wonderful day, and we will see you bright and early very soon.
1, 2, 3, good morning.